This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today I'm going to talk about when you should see an orthopedic doc versus a primary care doc. If you like this video, we put out new content weekly, so please like and subscribe. So obviously I'm biased because I am an orthopedic doc. I have a background in orthopedic surgery, and I have frustrations on my end when I sort of notice primary care doctors kind of mucking around with things that they don't need to. So to sum all that stuff out, now look, there's a lot of injuries that'll heal on their own, they'll get better. Your primary care doc can send to physical therapy. However, if they don't get an exact diagnosis, the physical therapy is not going to be as effective. So this is the rule of thumb that I use. If you're seeing you certainly can go to your primary care doc first if you want. If it's not too severe and it's just you're able to live with it, that might be a good place to start. If it's severe and it's really bad, I would just skip the primary care doc and go right to the orthopedic doc because they're going to be more helpful. Now, if you do see the primary care doc first and they send you for physical therapy, if it gets to the point where the primary care doc is thinking about ordering an MRI, that's the point when you should see the orthopedic doc. A lot of primary care docs don't actually look at the MRIs, they just look at the report. And again, MRIs have all sorts of incidental findings, so unless you know exactly what you're looking for, they aren't super helpful. So if you're seeing a primary care doc and they're saying, hey, let's try some therapy first, that's reasonable. You try it, you're not getting better. They say, I think I need an MRI. They can get the MRI, but I would go to see the orthopedic doc. Otherwise, you may end up with not getting the best care, in my opinion. So that's my 2 cents on it. If you have an ortho you like and you have an injury, you can go straight to them. I think that's reasonable. If you don't and you want to start out with primary care or your insurance makes you, I think that's reasonable. But if you get to the point where an MRI is needed, that's probably the point where you should seek a higher level of care. So I hope I was able to answer your questions about when to see a primary care doc versus an orthopedic doc. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice about your condition because this video and all my videos are for educational purposes only. Thanks for watching.